9:15 now this morning. Children who struggle with their weight are showing success using the weight loss drug Liraglutide. A study found that kids who used the drug in a late-stage trial lost significantly more weight than those who got a placebo. And the drug is considered safe for children ages 6 through 12. Joining us now is Dr. Shika Jain with UI Health. Good morning, Dr. Jain.
Morning.
Let's talk about this development. How significant is this news for kids who do struggle with weight?
So I think this could be significant, just like when we saw those other GLP drugs come out for adults. This could be a really big game changer for these younger children out there who are struggling with their weight. We know that childhood obesity can actually result in long-term medical complications. So if there's more data that comes out that shows this can be effective and doesn't have long-term negative impacts on kids, this could be actually great for children and for long-term health.
We want to switch gears here. This is a study from July that found arsenic and lead in feminine products, and it's prompted the FDA to examine the potential harm to women. Now, the study discovered only the presence of the metals. It did not test whether metals are released from those products when they're used. So all of that being said, how concerned should women be right now?
So right now, don't be concerned about using tampons. I think you can still use tampons. There's no evidence that the metals are being absorbed into the body or having any negative impact. That being said, if you do use tampons, I would say just stay alert to the news. Make sure you're paying attention if any other breaking news comes out about it. But right now, I don't think there's any concern. Just don't use a tampon for more than 8 hours and don't use it at nighttime, as has always been recommended. But there's no data that shows these chemicals or these things in the tampons are dangerous. So I would not be worried as of now.
And I'm assuming that I know that we're not scientific researchers here, but I'm assuming the heavy metals got in there because of the cotton and things that are used, maybe?
It's possible. I mean, we'll need to look more into where that's coming from. But again, I don't think there's medical impacts that have been proven yet. So we just need to keep looking at the data, do more research. But tampons are fine to use for now.
Okay. Thank you, Dr. Jain. I know that's an uncomfortable topic, but one we wanted to address. This weekend, you are hosting a special event, Women in Medicine. It's a Women in Medicine Summit. Tell us all about it.
So it's actually Women in Medicine Month this month. And a couple years ago, I started a summit focused on empowering women healthcare workers around the country to really take control of their careers and change the systems within which we work. Because we know that there are huge disparities in our healthcare workforce, and that directly impacts the health of our communities. It affects women's health, it affects male health, it affects everyone. So I started this programming to really work on getting more women into leadership positions and to have these uncomfortable discussions on how we can really transition our healthcare system to one that's equitable, not only because it's what's right for our workforce, but also because it actually impacts the health of our communities very directly.
Where can people get more information if they want more on that summit?
So you can go to womeninmedicinesummit.org. We also have a nonprofit, Women in Medicine, that you can go check out at wimedicine.org. And again, data has shown that women physicians actually have better outcomes, and women surgeons actually have less complications of their patients during surgery. So highly recommend you check out our website, come to the summit, or come to our Women in Medicine Gala that's taking place Friday evening. Tickets are still on sale for the gala on Eventbrite as well.
All right. Thanks so much, Dr. Jain.